I am the methodology interlude here between the substantive discussions of gender norms, and I think we'll move from talking about gender norms and how they affect corruption, and I think after me will be really that now what? What do we do about it? But I will share some lessons from these two projects that Cheyenne mentioned on how methodological lessons about how to assess the intersections between gender norms and social norms and how they affect corruption. So again, just a couple of notes on where the lessons come from. As Cheyenne said, it's from work with PIC, where Isaac is, and with Transparency International Initiative Madagascar. We partnered with them in sequence to develop and pilot a methodology for exploring the interaction of multiple norms, including gender norms, and their effect on corrupt behaviors. And he said we did that because we saw, and we know methodologies for identifying social norms were fairly well developed. And we and others, many of you in this Zoom meeting, had done analyses of social norms driving corrupt behaviors in other contexts. And work existed, especially in other fields, on how to analyze gender norms and break them down. And there was work on gender analysis and mainstreaming. There's a lot of work in that in relation to anti-corruption. But surprisingly, we found very little on how gender norms intersect with the social norms that drive corrupt behaviors. And we found very little on how on gender norms and corruption. So that's what we set out to develop and test a methodology for assessing that. So these are the lessons. In trying to make this methodology robust but simple enough to be doable, we started with the premise of adapting the existing social norms identification methodologies to explore intersections. We used a qualitative methodology, the vignette-based method, where for those of you who don't know it, we create a hypothetical story about a fictional character in a locally relevant and resonant context, making decisions about how to behave, for example, whether or not to solicit an informal payment. Then we ask questions about the behavior and their motivations for it in order to elicit the components of a social norm. That would be the main character's beliefs of what is typical behavior in that situation, their beliefs about what others would expect them to do, the rewards and punishments for engaging or not engaging in the behavior, and of course, which group holds those expectations and sort of exerts the pressure on them. And we did the vignettes because corruption is such a sensitive topic. The vignettes gives a little bit of distance and perhaps encourages people and gives them some safety to answer more honestly in that context. So it was fairly straightforward to integrate general norms interactions into this process. We simply added a variation to the basic story. We changed the gender, for example, of the main character, let's say a doctor, from a male to a female. And you can see an example here from Nigeria on the slide. In the second variation, we changed the gender of the counterpart in the corrupt transaction. So, for example, the patient being asked to pay the doctor's request for payment, changed them from a woman to a man. And then we asked how things would be different for them. Would they behave differently? Would they have different expectations along all the elements of a social norm? We learned quite quickly that you need to be very clear on what you want to explore in relation to gender norm influence, because you can really only change the story twice. Beyond that, the interview or focus group process becomes too long, so you can't finish your inquiry. Or it becomes confusing for the participants. They have a hard time following the story and therefore answering the questions adequately, which brings me to the second lesson in sense, which Cheyenne had emphasized at the very beginning. It's why it was important, as with all social norms, to be clear first on what behavior you're focusing on and who does it before you start thinking about norms at all. A doctor's request for payment is different behavior from the patient's paying it or offering some sort of payment. And the way that gender norms will affect whether, when, and how doctors solicit bribes will be different from how they will affect patients who are offering or being asked to pay a bribe. So the social norms inquiry will be different with doctors than it will be with patients, obviously. And so clarity on who you're focusing on and what they are doing will help make sure that you're collecting the right information and it will be useful for your programming. So a third lesson had to do with going beyond looking at differences in behavior. A lot of when we were looking at the literature on gender and corruption, a lot focuses on differences in attitudes between men and women, differences in behavior, for example, the frequency with which men or women engage in paying bribes or asking for bribes, et cetera. And this is really important information, and we don't collect it enough. We don't disaggregate enough at all. But it's the tip of the iceberg for exploring social norms. And why? There are three big reasons for me as we learn from the reflections on our team. One is that gender differences in behavior may exist for a number of reasons, some of which may be completely unrelated to gender norms. For example, a man may offer a bribe to a health worker to skip to the front of the line at the hospital for very practical reasons. He's worried that the medicines will run out before he can get to the top of the head of the line with his sick child, or he needs to get back to a job that he can't afford to lose and he doesn't have very much time off. So those are practical reasons, but there also may be reasons related to gender norms. So for example, he may be mocked or criticized as not being resourceful enough or aggressive enough to have gotten treated quickly by his colleagues at work or by men in the community, for example. So that's one reason. A second reason is that there are several possible gender norms that may be driving a single behavior. So for female patients, gender norms that they should be nice and not challenge or confront people, and they should be, may drive their reluctance to resist health workers' requests for payments. And that's reinforced by another gender norm that they should do whatever it takes to fulfill their home family responsibilities or be a good mother or daughter, as Karen said in her presentation. Even if that means giving a bribe, that may override it because that's so important. And finally, sometimes, as we found in Nigeria, not so much in Madagascar, actually, but in Nigeria, there may be no perceived difference in the frequency, but gender norms can still create subtle differences in how the behavior is carried out or justified. So in the inquiry about the intersections, it's really important to go beyond simply identifying what is different, to understand why and how it's different and where gender expectations play a role and how. And this is how I think helped us understand whether and what gender norms, as well as what non-normative factors were causing some of these differences and how. And of course, it's important. I think I don't need to say this. Everybody knows this. It's important not to forget that both women and men are influenced by gender norms. And the norms are different for each. So you need to analyze both and including all of the elements of the social norms, the gender norms for each of them in those transactions. Finally, or not quite finally, probing for norm conflicts. As Cheyenne mentioned at the beginning, people are members of multiple groups and they're subject and they're parts to multiple norms at the same times. And as we found, the norms can interact in many ways. Sometimes a gender norm can reinforce a social norm, in supercharging it in some way. So in Nigeria, for example, community-based social pressures on health workers, which apply to everybody as providers, were reinforced for men by gender norms that men should provide for their family and that they associated their masculinity with that provider for that provider role. Sometimes, though, norms conflict, and often for women, but not only. And when they do, a lot of the social norms literature suggests that one should figure out which norm wins, which prevails. It's stronger or more relevant in the situation, so people will follow that one norm. And this may be the case. And in many situations, but sometimes, as we found in Nigeria, again, a little less so in Madagascar, where one did prevail, but the norms may be equally salient or influential. So in Nigeria, again, where the health workers were expected to be kind, caring, and honest, yet also expected by their colleagues to collect payments and by their community to be providers and to provide generously for them. And so here, as Isaac said, there's a tension or a dilemma that people face. And so you need to probe not only how people behave, but also how they take their decisions, how they justify their behavior in these situations. People are very good at reconciling conflicting expectations with workarounds or moral justifications and rationalizations. So the women subject to this dilemma in our Nigeria study then resolved it by engaging in the behavior, asking for payments much more covertly, for example, at night, and really taking care to justify them as part of their caring duties. The payments, they said, allowed them to cover transport and supplies that they needed to give the servants to patients. So they're being consistent with the gender norm. And that helps you really get a fuller picture of how the gender norms really influence the corrupt behaviors.
Diana, I'm going to need you to
yeah.
about 15 seconds.
Yeah, my final piece is really just, I can't overemphasize how important it is to resource the assessment effort and train and support data collectors adequately. This process takes more time to collect data, more questions, more people to talk to, more analysis, and it needs investment, it needs expertise, not just training people on research instruments. Otherwise, if they don't have the expertise, they may get good information on attitudes, but miss social norms or surface differences, but not understand the norms behind them.